Elisa, you are good to go when you are ready.
Elisa, are you there?
Yes, I am. Sorry, I was just arranging a couple things on my screen.
No problem. I wanted to, I did want to let you know that we would like to make a revision to the agenda under, I'm so sorry because I forgot I'm not in control of it, under Director Mixdorf's, the item B, transition request. We just would like to not have that.
Okay, so whomever makes an motion for approving of the agenda, if you would move to strike item B under discussion items. Okay.
Thank you. I appreciate it.
Yeah. Thanks for calling that to our attention before we got the meeting going.
I can do that.
Thank you. Okay. Is it time, Eric? You're like, yes, it is, Elisa. Okay. Good evening and welcome to the October 22nd special board meeting of the Ames Community School District Board of Directors. I call the meeting to order and I'll entertain a motion to approve the agenda.
I move approving the agenda, but amending it to remove item 3B from the agenda.
Second.
Moved by Beerbaum, seconded by, I think it was Perez. Yep. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. Director Shields Cook, will you please read the purpose statement?
The Ames Community School District commits to equity and access that empowers every individual to reach their full personal and educational potential.
Thank you very much. I will real quick read our statement regarding public comments. As we have followed in past meetings, we will allow public comments after our discussion items as well as when we have our public forum. Residents of the district, students attending the district, parents or guardians of students attending the district, and district staff members may address the board about any topic relevant to the district, whether on the current agenda or not. Those who wish to speak must sign up at the beginning of the meeting. Speaker participation is limited to 3 minutes once per item. The views and opinions of citizens addressing the board do not necessarily reflect those of the board, district administration, or staff. Speakers are to remember that Iowa law prohibits the board from discussing specific employees, students, or their performance. Student speakers will state their name and school. Others will state their name and address. And we will go ahead and begin with the first discussion item, which is the COVID-19 decision-making matrix. And I will turn that over to Superintendent Reisner and Dr. Kathy Arnold.
Thank you so much. And thank you all for meeting again. I know that it doesn't seem like very long ago that we met. So, you know, I want to first start by saying that I know that this decision or this board meeting and the ask it comes as maybe a surprise. And so for that, I really do want to own that and apologize if the communication that we wanted to be there really wasn't. And so please know that I understand that this is a really important decision for you all. And I really respect you all as a board. So thank you. So I do want to say that tonight I'm going to be asking you as a board to make a difficult decision about learning. I've recently been in contact with our local medical community, and I met with them last night along with Dr. Arnold. The medical community does strongly believe we should be back in face-to-face learning, and they communicated that to me very clearly last night. The metrics that they helped us develop in June, they're not feeling that they support those recommendations. The reason for that is because they have had new learning and experiences with COVID. So I know as we have muddled our way through COVID, we've talked many times about how the learning happens and we have to make adjustments. So I think as a district, it's important that we listen to the knowledge of these experts, obviously, and along with Dr. Arnold. You know, I said earlier, nobody knew in June what would happen when schools reopened. And we now have been able to see districts across Iowa and locally reopen safely. And then, while we all do face unique differences from district to district. One thing that is common, though, is the intense need to return, especially our elementary students, and the low level of risk that this presents. So after meeting with these experts, Dr. Arnold prepared with these experts, Dr. Arnold prepared kind of a revision of our guidance document. And so while I know that as a board and as a district, we really want to rely on this document to say, this is why we're in hybrid, or this is why we're 100% face-to-face. Education doesn't really work that way. And so one of the things I love about education is that as educators, we're committed to continuous learning and that process. And so we use it with students and we use it as an entire organization. This means that we're constantly observing, learning, assessing, and refining. And so based on tonight's conversation, we will bring this back to the board, these revised metrics back to the board on Monday at the board meeting. So Dr. Arnold, if you would be prepared to share that and share, any insight from our meeting last night with the medical experts. And one thing right before you start, I did want to share is our medical experts were extremely complimentary of our school board. They really have appreciated the way that this board and this district has approached the COVID crisis. And so they did really commend the board and the district. So while I say that they're not in support of our metrics anymore, they are very complimentary of your work as a board.
Sure. Thank you, Jenny. I would like to, first, I thought it would be important, since we're talking about this, to provide just a look back and a very, very brief overview to help our board and community kind of understand our metrics process, how they were developed, reviewed, and present that option that Superintendent Reisner talked about to modify our metrics. When I started with the district on August 3rd, I was asked to continue that work that Superintendent Reisner was discussing on that process put in place to develop metrics specific for ACSD. That process was put into place initially because there was no centralized guidance either from the federal government or the state of Iowa about how schools should select learning models. How do you even make a decision based upon the presence of COVID-19 spread in the community? After the work was started at the end of July, the governor released metrics indicating 15% positivity with high absences or 20% positivity alone to determine a move to remote education. Our local medical experts, along with our board, felt state metrics didn't provide clear reasoning why their metrics were significantly higher, and what was being presented in the schools or what was being presented in the rest of the country. So what we saw was different in the state of Iowa. So that medical expert group looked at that and created our metrics that you approved. We made sure that our metrics were communicated. Also, they're a guideline, not a regulation or a rule. Caution was shared initially with that medical expert group, just as Superintendent Reisner said, about being very careful to use these things as rules and as a sole decision maker. So the goal of the current ones and any future metrics are to be used as a component with other factors to be used to make decision on learning models at any time. So what prompted our even looking at, other than the medical experts stating they felt that they needed to be revised. When the CDC released their metrics in September, we finally had some federal guidance. I did do a review of our metrics to compare the two. I was also asked to look to see if there were comparisons with different metrics based upon grade level. I presented both of those at a previous board meeting. And while I talk to Public Health daily and meet with a group of medical experts and city officials weekly, I had not specifically asked either group nor our initial group of medical experts to re-review our current metrics. I appreciate the suggestion and discussion at our board work session earlier this week. As being 4 weeks in the hybrid and 6 weeks in the school, it was probably important to ensure that what we proposed in August is still aligned with their opinions, and it was a good idea to do. So as Superintendent Reisner stated last night, we met with that same group of medical experts that assisted us in the initial creation of our metrics, including Dr. Passion, pediatrician and chair of the board, local Story County Board of Health, Les White, the director of Story County Public Health, and Amber Deerdorf, the vice president of clinical and support services for Mary Greeley. It was a good time for discussion. I shared the CDC metrics with the group and discussed our suggestions, had a good discussion of feedback on how we could update our metrics to better reflect our level of risk given our local COVID positivity and case count. And through the discussion, the group decided that increasing our low risk category from less than 5 to less than 8 positivity, and a case rate, moving that from less than 10 to less than 20, was a better estimation of how low risk is for our local K-12 student population. We also talked about local and state comparisons, as well as limitations of the dashboards that are out there to help us actually determine case spread in schools. With that, I know that the school board asked for school-based data about the spread of COVID within schools. And I did find 2 articles, one written by an economist that shared some Qualtrics data that's doing a study on tracking COVID within the schools. It reviews 200,000 children in 47 states, indicating a very low infection rate in students and staff in the schools that were included in their data set. There's also a very recent article in the Iowa Press Citizen describing Iowa City schools' experiences with opening and COVID. And while their district did report they've seen a rising number of cases since their in-person learning resumed, they did not feel the transmission had taken place inside the classroom, but was more related to outside activities. From that discussion, and Eric, if you want to pull up the suggested update, from that discussion, I'd like to submit for your consideration a revision to our current metrics to increase the low risk category from a positivity of below 5% to below 8%, and for our case rate to increase from less than 10 to less than 20. In this document, I've included CDC's risk stratification for your review. Again, the CDC clarifies, they don't tell you exactly which model. They say this is the level of risk associated with a variety of values of metrics. In our discussion last night, Dr. Passion did indicate he felt that the most important part of the metrics were the risk mitigation strategies that could be used as a piece of the puzzle of to include in our metrics. Finally, just again, I wanted to say we were cautioned strongly by our medical experts that the metrics should not be used as the only factor in making board decisions. Specifically, what was discussed tonight was not to have a specific threshold or to worry if it's 8.1 versus 7.9. These are general guidelines and in their opinion should be used as so. So thank you, Eric, for pulling up the document, and I'm open to any questions or clarifications that I can provide.
Dr. Arnold, can you share in terms of the recommendation of less than 8%, what is that based upon? Is that based upon, guidance from some, and it's not based on the CDC guidance, but is it based on some other guidance, or is it based on their observations in our community? What is that based on?
It's based actually on a couple different things. If you scroll down a little bit, Eric, you'll see on beneath this, there we go, right there, perfect. The 5 to 8% in that moderate risk transmission in schools, that was one of the pieces that prompted the 8% discussion, as well as Dr. Passion's opinion that he felt over 8% felt locally, in his opinion, that was an indication that we were headed towards a higher community spread. So there were multiple reasons for the 8% recommendation.
Thank you.
Mm-hmm.
Did the medical experts have any opinion, Kathy, on how to look at both of the metrics? Because we have two metrics that are being used simultaneously. And I know there'd been some concern you'd had of whether those should be OR'd or AND'd and in which direction and things like that. Did they have any thoughts on that based upon updated guidance?
No, honestly, no. We discussed mostly positivity because that's what's been used more across the state of Iowa. Again, just there's different pieces to it. So I would say our focus was mostly on positivity. I looked back also with our positivity, and obviously there's not a direct correlation because it depends on the amount of testing versus how many cases you're going to have. But in general, at our data, a case count less than 20 does correspond traditionally with a less than 8% positivity.
Was there any guidance regarding the guidelines they were for quarantining? So right now we're given two sets of options, right? Is there any guidance in that sense? Should we stick with one? Should we, if we up the number, is there any guidance? Is there any change on that?
I don't feel that, and Superintendent Reisner, I don't remember. It was a lengthy discussion. I don't know that we specifically got into what should be recommended based upon that, whether it should be following the CDC's guidance versus the IDPH guidance on quarantine. As essentially, we are following IDPH's guidance for that because we do not require it unless masks are not worn. But we do, that we have previously educated parents. And if I can be completely honest, we have not had a situation where we have had a close contact yet where masks were worn. So I can't give you an answer on what parents have chosen because that has not presented to us yet. We have only had close contact situations where masks were not worn, which is there isn't a decision process that is clear according to the IDPH that does require a 14-day self-quarantine from exposure.
Do you feel that a recommendation is necessary if we were to up the metrics to stick with just, let's say, the CDC guidelines? Do you think that's necessary?
I don't know. I'd have to really think through that, honestly, and I could come back to you with that. We're hard pressed often to completely disregard the IDPH's guidelines on quarantine because they are the ones who are governing that for our state. It does make it more difficult when they are not in alignment with the CDC. So it's hard for me to honestly give a well-reasoned answer to that question.
That's fair. Thank you.
Dr. Arnold, I have a question about the mitigation strategies. Has that language changed at all or been modified from the original metrics we put out?
The 5 key mitigation strategies are from the CDC's. That is there. It was just to highlight that those were not initially incorporated into our initial metrics. That is the 5 key mitigation strategies from the CDC, and just it was being used in our discussion with the group last night about the importance of that and highlighting the importance of those mitigation strategies as part of decisions.
So it wasn't on the original one. No. I guess what I'm asking is so the copy of the metrics I had didn't have that language, and I just wondered if I had missed a draft.
Nope. So no, that was part of the revision, just highlighting that because Dr. Passion felt that those mitigation strategies were essential. And
I would agree. And I was actually looking at the CDC website today, and they made a big deal about kind of these primary indicators and then these secondary indicators. And I guess what I was wondering is, so the CDC is using the language social distancing to the largest extent possible. If I'm looking at that list, that strikes me as probably the area where we would not be able to be in compliance if we are 100% back. And so I have always heard from the school district language about the 6 feet social distancing. What does social distancing to the largest extent possible mean in this context?
It is regulator speak, if I'm going to be completely frank and honest. The CDC does not traditionally put specifics to that. And it's saying that you should do it to the, it's because they're not going to say social distancing has to equal in all situations a certain amount of feet. I think it's in the website, it talks about that these are recommendations, and I think it's just knowledge that there is not always an ability to have a full 6 feet available. So it's really making sure that that's in there, but I can't speak to specifically why the CDC said that. But from policy and regulation, my research and my experience with that, it's usually because they like to give guidance and not give specifics on things like that.
But what would it be for us at the elementary level?
So our goal, obviously our goal is to do 6 feet when possible. We don't know. Jerry has a great map on and looking on what our impact per room is, and our goal is 6 feet. Definitely, we have said that 6 feet when masks are off would be required. So that's lunch. If other than that, it's something that we're working through right now. But we do have the other mitigation of having masks on.
I'm sorry, go ahead.
No, you go.
I guess this is what I'm trying to understand. So I understand what you're saying about the metrics, and we can't only use the metrics and we can't only rely on the metrics, but we do need to rely on the metrics in some way. I mean, that's literally the point of the metrics, is to give us some kind of guidance. And so if this is going to come back to the board, what will be helpful for me is to know what that means, how the district is quantifying what social distancing means, because as you said earlier, it is one of the considerations about where we're actually at, right? It's not just the stuff that's it's not just the positivity rates for the 14 days, but it's how we're able to meet and implement the 5 strategies. And if one of the 5 strategies is, let's just say it's 5 feet of social distancing, and we can't do that, then we need to understand that that's one of the strategies we can't implement. So I guess that kind of freewheeling language isn't really helpful if it's something that indeed we need to know, are we meeting or are we not meeting?
I definitely appreciate that feedback. It's the quote from the CDC. I appreciate that we probably need to put some stronger language around that from our perspective, and we can look at that and look to bring that back on Monday. I can't give you a firm answer on what a specific number would be at this point.
Dr. Arnold, I was just looking on the CDC site, and it does say 6 feet.
It does.
It does say 6 feet in the school section when they define more clearly social distancing. So I just think you should take a second look at that.
I will. And I think, again, the difference here is they define what social distancing is. The problem is their language saying social distancing to the largest extent possible. And I think that is the part that's the issue. If they just said social distancing, the answer would be 6 feet. Social distancing to the largest extent possible is, I think, what's giving Director Mencken pause, because, and why I think it is not a clear definition. Social distancing, I agree, is 6 feet. It's what does to the largest extent possible mean?
They clarify it under one of their bullets.
Well, thank you. I will look at that.
Do we have any, I would also wonder, has the local health experts you've consulted with, have they had any thought about what that should mean? The reason I bring that up is I recently spent some time in probably one of the more secure pediatric areas in the state. And I noticed that the way they define this is actually exactly like this, where it's to the largest extent possible. Or oftentimes they go less than 6 feet, but they try to make sure they can when they can. So this might be an area to get some feedback from local health again, to make sure we meet what they think their recommendations would match.
Thank you for that. I appreciate that. And I will follow up with them as well. And possibly what would have been more clear, and I apologize to the board for this, was to have that bullet point be under the CDC link. It honestly and transparently, it was there because it was part of our discussion last night. And so it would have been more clear had I put it under the CDC where it's should be currently associated.
Dr. Arnold, I just want to make sure that my understanding was the new CDC metrics that's below, which talks about these 5 key mitigation strategies. This was the recent advice that came out within the past maybe 4 or so weeks. Am I right on that?
Correct.
Okay. Okay.
Yep. Okay, well, hearing no further comments, my takeaway and what I will bring back to the board on Monday is the ACSD definition to what social distancing to the largest extent possible would mean for the purposes of these metrics.
And just to be clear, this is what you took to that group of local medical experts in review, similar to, it's the same group that we had worked with earlier this summer. Okay.
Correct.
Okay.
Can you scroll up? So then there's only a 2% band for the center moderate on positivity. Okay.
Any other questions for Dr. Arnold or Superintendent Reisner on the recommended update to our metrics? Superintendent Reisner, did you have anything else that you wanted to say about those?
No, sorry,
Okay.
not
Okay.
about the metrics.
Okay. Okay.
The only thing I would add would be that Dr. Passion did talk a little bit about, well, I think Kathy covered everything in there anyway. It's hard, like we've said before, some of those distances and things, landing on an exact number can be a challenge. And so I'll be interested. I think it's a great idea to take that back and get some guidance, because I'll be interested in how they could help us with that, because that is one of the areas that is a struggle.
Superintendent Reisner, I just think, just for clarity, I think part of what will be helpful is it just will help it will help parents, I think, make decisions, just because I feel like everybody just needs to be clear about what they're signing up for. And it's just helpful is all.
Yes, thank you for that.
I don't
agree.
mean it as kind of painting anyone to a corner. It's just, I'm trying to find ways to make sure people have the information they need to make decisions that they feel comfortable with.
Absolutely. Yes.
And
Thank you.
It might also be helpful to understand how they are utilizing social distancing in their own areas, since we've got the vice president of the hospital and a pediatrician helping us to understand it through that lens.
Yes, very much so. Thank you.
Okay.
Can I ask one
Towards that,
final?
oh, sorry, go Sabrina.
I have one other question about something you said at the beginning, Dr. Arnold, which I think is a really important part of the discussion around the likelihood of spread among especially kids under 10. And I just wanted to clarify, you had mentioned a couple of articles, and I think I've seen both of those articles. I think my understanding is that there's not currently any peer-reviewed research out there about this topic, right? Because the studies are currently underway. There's nothing that's actually out there officially to say this is what these studies have found. The one by The Economist was sort of a preliminary, hey, I'm working on this study and this is what we're seeing so far, but there's not any peer-reviewed research out there yet. Is that correct?
The peer-reviewed research that is out there is international based, and that was what I had shared at the work session. There are studies from, I believe it was Iceland, South Korea. So, you know, they were areas that did have lower positivity, but those, there are no, that I have found, there are many things that are under review or in progress, but from the US, there have not been studies yet.
And the positivity rates in the places that those studies occurred internationally were like lower than 3%, correct?
If I would have to pull the studies up, I can't speak to specifically everyone, but I do know that they were lower percentage studies.
Okay, thank you.
You had mentioned, Dr. Arnold, that the medical experts were especially interested in those 5 mitigation strategies. Did they give a description for why? Like, is that something that they've seen locally, for example, that if some of those key ones aren't followed, that does lead to spread within schools or outbreaks? Or did they give any insight into why those 5 or which of those 5 might be most key? Or
I think Dr. Passion's opinion was that mask wearing was the most important of all of those. He and Superintendent Reisner, if you got a different perspective from him, I believe he was very, that to him was the most important of the of those in preventing spread.
Yes, I would say he pushed us to think, you know, outside of thinking of just social distancing. He pushed us to think about, okay, if you can't social distance, you have masks on, and that's, you know, it's important to get kids back in school. That, you know, I think that was the message that I took away loud and clear.
Did the local medical experts have anything to say about the risk for teachers and staff? Did they feel, I know that they feel that it's important for the kids to be in school for the whole child and mental health and all of these other reasons. Did they feel pretty confident that those mitigation strategies with the higher positivity rate are still creating a safe environment for staff and teachers?
That's a really great question. And so what I would say is that they talked about the schools around us have returned successfully with very little risk to, or I guess very little infection rate to staff. So that was what they didn't talk specifically about, you know, that risk in relation to metrics so much, but they did talk about the local school districts in Story County. And so that's what they were more speaking about. Here in Story County, we have not seen an issue within the schools, and that. Dr. Arnold, do you have anything to add to that?
I think that describes what was said last night.
And this may be asking a question that you aren't able to answer, and that's, I understand if you're not. Do we know anything about class sizes or spacing in the schools that have opened face-to-face? Are they able to maintain 6 feet? Do they have smaller class sizes than us? Do we know anything about that?
I actually did speak with, and I apologize if I interrupt. I spoke with Jerry Peters today. We were having a meeting, and he has reached out to the UEN members about some of those type of questions. And let me try to find my notes. They were not as focused on social distancing as we have been. And I'm trying to pull, I apologize. I do have some information on that, but it was more that, and of course I'm not gonna be able to find it written right now, but there were, in general, there was much less focus on specific numbers of how many feet in those districts.
Did you get a chance to speak to them regarding testing? Are we doing enough testing? Are we testing littles? Do you get any sense of where we are at that? Are we doing a good job testing here in Story County?
I believe Story County is meeting our what the recommendation is for, or they were. I think we're a little low. It's hard to tell, honestly, for Story County, because right now Iowa State's doing asymptomatic randomized testing. So how we are testing and our numbers are really hard to tell. In general, we have been sufficiently testing, but according to the numbers, though, it's hard to tell, though, again, because of the effect of the ISU testing. There are some, I was just talked about some testing that being available at medical providers, targeted to K-12 schools, that would still be having to be done through the medical provider. However, that is in an early stage of rollout and would be currently for symptomatic patients, but that's not implemented yet locally. But there are ideas on the horizon. There's also locally some efforts to get a rapid test open at a site, but that still has not. That would be probably, I would hope, within the next month, but just from those reports.
Thank you. That'd be great.
Any other questions or comments for Dr. Arnold or Superintendent Reisner?
Sorry. I did shoot a quick text message out to my Story County superintendents regarding their class numbers and social distancing. So if I hear something back before the end of the meeting, I will report out.
Thank you. Any other questions or comments about the decision-making matrix that we have been presented with tonight? All right, seeing none.
Before we go on.
I'm trying to use good wait time.
You're doing a great job. I will say that I've had Nevada responded back, and they are not able to do 6 feet. So they are less than 6 feet.
Thank you for that on-the-spot research. All right, as we have done before we move to public forum, I'm going to take comments on the decision-making matrix. And so again, these are only comments on the decision-making matrix, and then I will open the public forum. I'm trying to follow the format that we have been using. As a reminder for our members of the public, as we have a number of attendees and some may be new, you raise your hand. I will call on you. Eric will give you permission to speak. As a reminder, make sure that you have your mute button off. State your name and your address. And just as a reminder, we do not answer questions or provide feedback. This is just an opportunity for our comments from the public. So if anyone from the public would like to make a comment about the COVID-19 decision-making matrix, please raise your hand.
Elisa, while we're waiting, I just wanted to comment that there are 183 participants on. They like to know who's in the audience. So.
Oh, thank you.
Good company.
I always figured that they can see that number, but maybe they cannot. So thank you for, I make the assumption everyone can see what I can see, Director Benkin. So thank you for providing that. So.
And Director Franzen, while we're waiting, I'll jump in there. Gilbert said they do 3 feet, 3 feet and masks required.
Okay, thank you.
Jenny, one more, since you mentioned Gilbert, they also are using plexiglass, isn't that correct? Between students and also at lunch?
Okay. Thank you, Sabrina.
All right, so we will go ahead, and it looks like Carl Weems, you have been given permission to talk, and go ahead.
Hi, thank you very much. This is a really great conversation. I thank the board for asking those excellent questions about the social distancing issues and those kinds of things if we change the metrics. I really do have questions ultimately, unfortunately, but so I don't have comments per se, but I would like the board to consider maintaining a hybrid option for students. We recognize the importance of schools for families who are struggling during this time. The idea of keeping a hybrid option along with 100% face-to-face would potentially deal with the issue of the social distancing metrics. So the combination of the advice to move back to 100% plus the advice to keep social distancing, maybe having that hybrid option also as an option would deal with that. And that's all I really wanted to mention. Thank you very much.
Thank you for your comments. We appreciate that. L. Dorman, you have been given permission to talk. If you want to hit your unmute button, go ahead. L. Dorman, you've been given permission to talk. Are you there? Try to take your hand down and put your hand back up, and it might help us get you. Now you can talk. So how about we do this? We will go to public forum. We understand that you have raised your hand. Go ahead and raise your hand again. Feel free to raise your hand again because I will go ahead and open the public forum to other members of the community, and then hopefully that individual can try that again. So Paul Castleberry, you've been given permission to speak.
Yes, thank you for the time. The question I have, Superintendent actually presented some of the spacing for some of the surrounding school districts, which are smaller than ours. If we're going to follow the mitigation factors to the strongest extent, we're certainly not going to be able to hit that 6 feet distance. Any comments about that? We are a larger school district, so we're certainly not going to be able to hit 6. And if some of the smaller ones are hitting 3 feet, what is that for us? 1.5 feet?
Do you have any other comments for us?
No, that's it. I just kind of posting that out there. That's the concern I have, is the social distancing there.
Okay, thank you very much for sharing with us. Megan Wolf. And just a reminder, if you can give your address once you give your name, please.
Hello, can you hear me? This is Adam Wolf. Megan is my mother. I don't know why it says that. Good evening. My name is Adam Wolf. I am a senior at Ames High School. While I appreciate the board's continued advocacy towards a safe return to the classroom, I cannot help but find it concerning that the discussion and recommendations this evening have no mention of the secondary schools. I have read most of the many documents provided at Monday's board work session, and I understand and respect the concerns brought up by both the middle school and the high school administration in those documents. However, the lack of a provided timeline for a recommendation for the secondary schools concerns me as a student. I understand the absolute educational vitality of bringing the elementary school students back into the classroom first, but I believe it is necessary to begin work to provide the community, teachers, and students a timeline for allowing middle school and high school students to return to the classroom. It is not that the date of the return must be soon, but the decision must be. This way, the schools are given adequate time to adjust and to prepare for the inevitable changes they will face. There are many creative approaches to getting students back into the classroom in a way that could be safe, effective, and more successful than the current model. Having a date to declare to go remote or in person for the second semester would lift an incredible burden off the shoulders of teachers, specifically at the high school, who currently see endless roster changes with minimal notice. The opening of campus and the relocation of study halls to the gymnasium could allow for the auditorium and multipurpose room at the high school to be used as classrooms for classes burdened by spatial constraints. Continuing to allow instructors to teach from home would allow those most vulnerable in the community to continue to educate. We could even shift from our current 2 to 3 day hybrid model into a model in which all in-person secondary students go every day but Wednesday in an effort to give the teachers time to prepare their new material. There are many ways that together we can solve the problems we face. Case numbers in the county are such that now is a great time to be having this conversation, and I commend all involved on beginning this discussion. I would like to especially commend Superintendent Reisner, her team, and the medical professionals that have worked with the district in making these recommendations as sensible and safe as absolutely possible. Please know your work is appreciated within this community immensely. Thank you for your time and consideration.
Thank you, Adam. Celeste Chavez? You've been given permission to talk.
Hi, my name is Celeste Chavez. I live at 2615 Clayton Drive, and I wanted to take this opportunity to thank everybody at the school board, the community, and the teachers. We've been having a tremendous experience with having our kid learning online, and we appreciate the continuous effort that everybody has put into doing this and to making this really successful. I understand, and we understand that other members of the community may need or may feel the need to go back to the school. And I appreciate that this is given the consideration. And, you know, I wanted to just put it out there that we appreciate the opportunity to remain online and all the hard work that everybody is doing to make this possible. I cannot even imagine the amount of work that this is for everybody, but we thank you so much.
Thank you, Celeste. Kent Spillers. Oh, sorry, not Kent Spillers. I got out of order. B. Smith.
Yeah, so I want to say, just like others, thank you for your time and consideration.
I'm sorry for interrupting. Can you give your name and your address? We just have to have it for the minutes.
Yeah, Brian Smith, 5416 Maryland.
Thank you, Brian.
Yeah, so I'm actually calling tonight. I want to, I guess, ask you guys consider whether spacing currently is something that's being assessed. I know that the discussion is really revolved around distancing, but the question is, does the school district currently know what kind of distancing is currently being employed? And is there anybody that enforces that, goes through and checks that, measures that, and whether that'll actually be considered moving forward if distancing is truly a focus of this conversation? So just want to consider whether there's actually anyone that checks that and enforces that or even knows what it currently is.
All right, thank you for your comments, Brian. Kent Spillers. You've been given the permission. You can take your mute button off. How about we go, Eric, if you'll go ahead and go to the next person in line. Oh, wait, Kent Spillers, you just took your mute button off?
I'm sorry, it was hard. Can you
That's
hear
okay.
me?
Yep, I can hear you.
Ken Spillers, 3439 GW Carver. I emailed all of you. You guys have been phenomenal through all this, and I thank you all for your transparency again through all of this. But I'm a little concerned on the metrics, and there hasn't been clear guidance from the state and at the federal level. But I mean, if you divide, you know, the tests that we've had in Story County from October 8th to the 21st at 1,778 and 267 positives, that's a 15% positivity rate. So I get a little concerned. The 267 doesn't worry me as far as numbers, but if we're going to run this on percentages, that 15% positivity is not where we need to be. And I get when we run the state's numbers, we're very much nearing that 5%. But for what it's worth, I know I'm in the minority, but I've got a high needs child at Fellows, and the 2.5 days a week, if you average it, he's doing awesome. And my daughter at the high school is doing phenomenal. So I would just like to say I'm a proponent of the hybrid model. I hope you guys stick with it, and we make a decision after Iowa State comes back in January. Thank you.
Thank you, Kent. L. Dorman, you've been given permission to talk. Are you there? Looks like your mute button's on if you want to try to hit unmute. Maybe we have a connection issue. All right, maybe if you want to maybe try to log out and join the meeting again. I'm sorry, I appreciate that you're being hanging with us here. How about we'll give Amanda Weinstein.
Hi, so Amanda Weinstein, 2930 Cypress Circle. I would like to join the chorus of people who have thanked the board and the district for all the hard work that they've put into this and for your transparency as well. As parents, we really appreciate the fact that you've been so open about the decision-making process and what's going on. I just wanted to comment that in following this, one thing that has really confused me about the discussion is it's not at all clear whether this is a discussion only about that will only affect parents in the hybrid model, or whether this is going to have a more global effect on the district. So it'd be nice to have some clarity on that. And also to just say that I share the concerns of a previous speaker about the metrics and about the numbers, that it does seem that these numbers are very sensitive to the approach that you take to them. And there do seem to be a lot of confounding factors like the ISU testing that are mixed in. It's really hard to understand where we really stand, particularly since as a parent, I'm getting notifications of positive cases in the district. And those seem to have in fact become more frequent in recent weeks rather than less frequent. And so I'd like to understand how that factors into this entire picture and why that's not a concern.
All right, thank you, Amanda, for your comments. Anyone else desiring to speak this evening? Oh, let's see, Lacey Wheat Hitchings. You may go ahead and speak.
Hi, I'm Lacey Wheat Hitchings. I live at 16158 Hayden Road. I do want to say that I very much appreciate all the work that you've done, that the school district has done, and I have a great deal of faith in what you're doing. I do have some concerns, and I came into the conversation late. I'm not sure whether you've decided to address the new recommendations by CDC that is concerned about cumulative exposure, and it also sort of contradicts the Iowa Department of Public Health's stance that wearing masks is adequate and should be used as contact tracing guidance. This was released, I think it was yesterday. Has that been addressed?
How about we'll wait until, we can't comment at this point, but we have made note of your question.
Okay.
Okay.
All right, thank you.
You bet. Thank you for the question. Sarah Remery. And you've been given the permission to speak.
Okay, can you hear me?
Yep, I can hear you.
Thanks, Sarah Remery, 2116 McCarthy Road. Thank you to the board and to the staff. So my children started in the virtual classroom 100% online, and I'll be honest, it was a challenge for my family, but it was something that we felt we needed to do to protect our children. As it went on and as the struggles continued, when the hybrid option became available, we were a family that made the move. Since Ames numbers had been going down, we felt more confident hearing positive things from friends in different schools about the strategies taken to keep kids safe. And so we moved our children into the hybrid model. And it's been a really great balance of social emotional well-being for them, in-person instruction and support, especially on the critical things that they need help with that my husband or I are not experts in, as well as that reduced exposure and that reduced risk, both for the kids as well as for the staff. And my concern is that returning to 100%, and especially at the start of cold and flu season, and especially when we're going to be heading into a season where we're going to be relying more on inside shared airspace. It concerns me because it really puts my family in a position of weighing whether we return to an option that did not work well for my children socially, emotionally, and honestly, even academically, in the interest of their physical health and well-being. And so I would really like the board to consider staying in the hybrid model or offering the hybrid as an option to families, at least through the semester. Thank you.
Thank you, Sarah. Hardy at iastate.edu.
Hi, can you hear me?
I can hear you.
This is Amanda Hardy Hillman. I live at 2322 Baker Street. I just want to echo what's been said, especially by the last speaker as well. But I had a little bit of a concern that I want to make sure was noted, and perhaps I didn't understand how it was communicated. But when Dr. Arnold was speaking, there was comments to the lines of the Story County Health Department has said the other schools in our county have really, it felt like it was kind of said not had issue when notably, Nevada had 37 students quarantined in the last couple of weeks, 12 students quarantined. We haven't had to do that. And I think that the model that we've been using speaks to the fact that it's been working. So I suppose I really just wanted to comment to the board members to make sure that, these numbers are just, I pulled them up in some searches for some local schools as I had heard those things shared in the news. And I wanted to make sure that board members were looking at what our other schools in our districts have really been doing to make sure there was clarification on that. It was just a little confusing. As well, just to again echo that I really appreciate that we haven't had to do so. And I would like to see us continue in what we're doing for now. So thank you, that's all.
Thank you, Amanda. Stephanie.
Hello, I'm Stephanie Tang at 325 Beetle Drive. I am one of those people who has an elderly father living with me and a child who is, supposed to start preschool this year. I am not willing to take the risk of 100% in-person learning right now because my dad is in all the high risk categories for COVID, or even a flu could probably be very bad for him health-wise. So I echo everybody else who's been saying, hey, we probably do need a hybrid. I appreciate what you guys have been doing and it's great. And I am very happy to see that, our numbers are going down, but we can never we can't really take that risk of having my child bring something back that infects my father, and then what? So that is my comment. So thank you very much. And
thank you, Stephanie. I'm going to say maybe it's T. Drake. You have been given permission to talk.
Hi, my name is Taylor Drake. I live at 26398 Sand Hill Trail in Ames. I just wanted to say for the record, has anybody checked the American Academy of Pediatric guidelines on how they feel with the psycho-emotional aspect of kids being in school? It's not just math, reading, science. It's the emotional, psychological aspect of being at home during this pandemic. Also, has anybody talked, I came in late to this meeting and I do apologize about that, but has anybody talked to any of our local health professionals regarding what their guidance has been? Has anybody looked at the districts around us about how well they've been doing when they're in person, and the educational aspects as well as the emotional health and well-being of our children? Another thing to look at really is we do still have the 100% virtual online option. That is important for people that have risk factors. I understand that. However, people, we need the option to send these kids back to school. We need to start prioritizing our children. And that's it.
Okay, thank you, Taylor, for your comments. Jenny M., you've been given permission to speak.
Thank you. I am Jenny Mitchell, and I'm at 1416 Boone Street. And I just want to say that I support returning to school. And I agree with the last person who spoke that said that we need to be concerned about our child's well-being, their mental status. And not only that, but also the parents. Many parents are having to send their kids to daycare during the day when normally they wouldn't have to. So that, of course, impacts financially the families, that put more stress on them that is unneeded. So I think that we should have the choice to send our kids back to school 100%, just like parents have the choice to keep their kids home 100%. And that's all I would like to say. Thank you.
Thank you, Jenny. Alicia Crizan. You've been given permission to speak, Alicia, and you can take your mute button off. Are you there, Alicia? How about we'll move on to Jamie Morgan. Certainly, Alicia, please maybe put your hand down and raise it again. Jamie Morgan?
Yes, can you hear me?
Yes, I can hear you.
Right, my name is Jamie Morgan. I live at 1405 Arthur Drive here in town. I have 3 children in the pre-K 5 range, a 4th grader, 2nd grader, and EK student. And I also want to voice my opinion that I think we need to have a 100% learning in-person option for my students. It's the remote learning, the hybrid is going okay, but it's not going great. And I just fear for, especially for my 2nd grader who missed, the ending part of 1st grade and beginning, with all this, the reading loss that she's experiencing, and just, that it's not meeting the needs of those students, all 3 of my students. And I'm home and able to help some, but it's also not ideal. But I also want to say that it's not ideal for the teachers. The hybrid model as it currently is, without a day for the elementary teachers to have some prep time, is not sustainable. I know my son's 4th grade teacher is spending 15 hours a day getting everything ready for the hybrid kids, and then because she's good and she's thorough and she's working really, really hard, but that's not sustainable. And if they had kids in class and weren't trying to teach some in the class and some online, it just, it's so, if we're going to stay in the hybrid, something needs to be done to give teachers the time they need to prep for those hybrid classes, because they have kids in the classroom all day. They don't have time during the day to record those hybrid lessons. And so they're having to do that on their own time, and that's just not sustainable. So thank you.
Thank you for your comments, Jamie. Lauren Lunsfoot.
Hi, can you hear me?
Yes, I can.
Hi, this is Lauren Lunsfoot, 713 16th Street. I just want to make sure we're remembering our teachers in this. I understand that for our kids, this is hard, and every parent gets to choose whether they send their children to school or not, or if they do the online option. And we all have to make that decision, and it's difficult. But I hope we continue to put our teachers at the top of our thoughts in this. They don't have as much of a choice in this, and I know that we've heard from some of them that they are overwhelmed with the thought of having that many children in their classroom where they cannot social distance. So I hope that we continue to think about our educators, our staff, the people that are in the classrooms with this virus and with our children. Thank you.
Thank you, Lauren. Emily first.
Hi, thank you. This is Emily First. I'm from 5312 Thackeray. And I'd first just like to again echo my, gratitude towards the entire board for taking this very seriously throughout this entire time and considerately thinking about families and teachers in our entire community. So one of the things I'd like to think about too is definitely want to echo the concerns regarding the metrics. So I know that you guys are looking very closely, mostly at our local metrics, which are also, critical for our community, but also to make sure you're considering our regional as well as our national metrics. And I work for a large multinational company. And so I have a little bit more of an earshot to what's going on around the world and even within our own country. And it is quite startling that we see a large number of areas going back on lockdown. As we enter into this new flu season, though if we were all practicing things safely, we should not have to worry about any crossover for any disease for that matter. We realize that that's completely impossible. So thinking when we're considering just allowing just our K through 5 to go back to school full time. I admit my children are part of this hybrid model. I have one in K through 5 and I have one that's in middle school. This would increase the chances of crossing over within these bubbles, if you would, between groups 1, 2, and 3, and 4. You would be taking down that model and crossing those bubbles for all children in that one sector of age. Then you have to consider the groups and families that have children in multiple segregations of age. So either elementary, middle school, and high school, and then a diversified families within our community. So I would also consider that as a key interest, that when you're making these big changes, especially as flu season is upon us in the winter months, when flu season, is high, but then also when we see all around us, disease incidence and COVID-19 transmission is going up, even though we're talking about what seems to be a more immune group, the rest of us around them are not. I know that the hybrid model is not perfect, but it has worked very well for our family. It has been a struggle for us, both financially and on our time for our jobs. And also, I really care and very much deeply appreciate all the work that our teachers have done to make this model happen. And I just want to make sure that we are considerate for everybody's health in the end. I would choose to keep the hybrid model at this time, at least through the end of this winter until the new season, and we can see how the general flu and pandemic is continuing to go in our local community, our region, and our state and our country. Thank you.
Thank you, Emily. Any other individuals from the public desiring to speak this evening? Karen Danley.
Hi, my name is Karen Danley, and I'm at 1223 Northwestern Avenue, and I would really like to hear what the plan is for substitute teachers. If we know there's a substitute shortage now during this hybrid model, and we send all students back, how is the district going to deal with this? Thank you.
Thank you for the question, Karen. Any other comments from the public? Seeing none, we will go ahead and move on to the action item, and I will entertain a motion.
I move the board approve the superintendent's recommendation to return grades PK through 5 to 100% face-to-face instruction as presented.
A second.
Moved by Benkin, seconded by Beerbaum. Discussion.
So I will go first. I feel really not in a place that I have information to vote on this tonight. I have a lot of questions still, and I've asked some of those questions. You know, there's been discussion about the local health, the local medical experts saying that we're not seeing spread in our schools. That's a subjective statement because, as one of our callers mentioned, you know, Nevada had 37 students quarantined. There have been classrooms shut down in multiple schools. You know, I would like to see actual data or evidence that's suggesting that we're not seeing the spread in the schools, rather than just hearing anecdotally we're not seeing the spread in schools. I'm still very concerned about our teachers. We have heard from dozens of teachers over the past couple of days who do not feel safe returning to 100% in person. They're saying they do not have the space in their classrooms to adequately social distance. They're worried for their own health. They're worried for their family members. A question that I would like, and I guess I'll put this out as a question. I've been thinking a lot about the teachers, and I know we saw the survey that showed that they were pretty split 50-50 on whether to return face-to-face or remain in the hybrid. I'm curious if there's data on, is there a difference between the levels? Were the elementary teachers more comfortable with returning to face-to-face and the secondary were less comfortable? Is there a difference between elementary and secondary?
I can answer that question. No. What was reported to us was there was no difference between. So it was, they thought there might be, and there wasn't. It was 50-50. Yeah. I want to make sure I'm capturing questions correctly. So I'm not sure if I got that first question that you asked.
So I feel like it's really important to have decisions that we make be evidence-based. And I hear people say we're not seeing spread in schools, but I would like to know, what does that mean? What does that mean? Because if we had 37 students in quarantine, how is that not spread? How is that not seeing spread in a local school? So what do they mean when they're saying that? Are they saying we haven't had any deaths from this? Are we saying?
No, I think that what they're saying, I mean, and I'm going to answer this. I think what they're saying is quarantining and testing positive are two different things. So there may have been a potential exposure, and parents chose to quarantine, and then at the outcome was there wasn't nobody tested positive, or I believe that's what they're saying. But so the question you're asking is, I understand. I think that you're saying you want to see hard numbers, and I don't know that we can have I don't know that we can get those. I can say there was 37 kids quarantined. I mean, I don't have the ability to go to another district and say, of those 37, how many tested positive? We don't. So we're limited on what we can get, but I certainly can beg and I will beg and see what my Story County superintendents will give me.
Well, and I'm even just curious from Dr. Passion and Amber Deerdorf and Les White, when they say that, what does that mean to them? What are they saying? That they literally haven't seen any spread in those schools, or the spread has been below a certain level, or it hasn't been to the level at which they had to close anything down? I mean, I'm very curious about that.
So that might be where we can really get better information. So I can certainly work on that piece.
Right, because I hear the value of returning, especially our youngest learners, to the classroom, and I'm trying to balance that with the fact that we do finally have national recommendations, and that this is maybe we're setting our standards a little bit higher than that, but also recognizing there is evidence out there suggesting that it's safe. I'm just feeling like I haven't seen anything that's not just anecdotal at this point to say that it's safe.
If possible, and I hate to interrupt at all, but I wanted to answer one question that Director Shields-Cook had, or a postulate on that. The limitation of the dashboards of quarantined kids in general is the same limitation as our dashboard. If we report that we have, and I'm making up a number, if we report that we have 10 children quarantined, that's how many we have quarantined. Of ours, I will say, the total in the entire, right now of who we have quarantined, I think we have about 25 that are on quarantine. 3 of those were related to in-school exposures. The rest were related to being exposed to a parent who was positive. So I'm not disagreeing with you at all on that fact. That's just one thing to keep in mind when we're looking at dashboard data like that is they're not necessarily reporting only quarantines related to an in-school exposure. It is a good representation. I'm not saying they shouldn't, because that is a representation of COVID in the community, but it's a hard line to communicate.
And I did want to, sometimes when a recommendation is made, the person that brought the recommendation has a quick minute to talk about the recommendation. And so I just want to go back.
Sorry.
That's
Yeah,
okay.
I'm sorry. I should have started. Superintendent Reisner.
No worries. No worries. I know everybody's anxious.
Anxious.
I know the anxiousness. I do want to, there are a couple key things though I want to say. First of all, we are acknowledging and understand the importance of parents having the choice to select 100% remote campus. That is not going away. So hear me when I say the remote model, the 100% remote is not going away. That is still there. And I think I spoke earlier tonight about, listening to those medical experts. And so I would ask that for a minute tonight, you would listen to me as your educational leader and expert in the area of education. I do have a deep understanding of the progression of learning and the results of learning, the impact, long-term impact of learning loss over time. And so I think the data that we so desperately want right now, we don't have, because it's longitudinal data. For educational outcomes, it's longitudinal data that we won't have for years. But, I know the hybrid model is not working for all of our learners. And that is concerning to me, because the learners that I'm hearing about it not working for, and again, we're going to find parents that it is working for, and we're going to find parents that it's not working for. But when we as educational leaders and experts look at it, listen to our staff serving those students and meet with the parents, the frustration is growing. They feel they cannot go on like this. And without a doubt, our learners' academic progress is being compromised, and to continue in a model that isn't working for all of our learners is simply unacceptable. So the question of who this model is not working for, it covers a broad spectrum. We know that it's not working for the majority of our special education students. We know that they are not having their needs met. We know that students on 504 plans, they also aren't having their needs met. When I say they, I'm not saying all, but I am saying a majority of our students in some of our marginalized groups are not having their needs met. When we look at our limited English learners, Dr. Jones said it again today. The hybrid model is not working for this group of students. When we look at our students on intervention plans, they're not getting the services they need. When we look at our homeless students, they're not getting access to our services. In school, out of school, they're not getting what they need. And we have our whole at-risk population of students that meet risk indicators that aren't getting what they need or progressing through the curriculum and standards as they should. So we could say, let's bring all of those students who are on plans back. And that would cover the majority of our learners. But then again, I ask that question, who is it not benefiting? So the answer then is the 10 to 20% of our students who still aren't progressing through the standards, but their parents aren't able to help them because they have to work, they've got commitments, or they're simply not able to provide that level of intervention and instruction that our students need. And so hear me when I say, I love our teachers and I love our staff. I love them. So teachers, I hear you, I understand you, and I truly empathize with your concerns. And I know that fear is real. I know that because like all of you, I too am an educator who is dedicated and passionate and has given their life to education. And so I know that your concerns are not because you don't want to serve your students. I know that. But as a leader, an educational leader of this school district, I can't ignore the local medical professionals who have been advising me, nor can I ignore the students who are not getting their educational services that they need. And I also can't ignore the successful face-to-face return of almost all elementaries in Iowa. So I commend our board. I know that this is a difficult decision. I know you want data that may not be available. And so I commend you, and I really appreciate the compassion and the care that you have shown throughout this whole thing. And I know I'm asking you to make a tough decision. But again, we've talked a lot about listening to medical experts, and I have to say, you hired me as the educational leader of this district. So what I'm saying to you is, hear me when I say this model is not meeting all of our learners' needs, and we will have longitudinal data that will show that in the years to come. So I really am asking, for that trust.
I was going to say something about that before you did, Superintendent Reisner. We hired you to be our expert. Most of us on the board don't have an education background, especially with public school education. I know my background is in IT and business, so I don't have that formal training. But we hired you to trust you and to trust your decisions. So I have to go with what you're saying. I have to trust you. I do care about our teachers. I care about classroom sizes. I care about so many things and about, infection rates and all of that. But if our educators are, sorry, my dogs are getting in here. If our local public health officials are saying that it's important that we get our children back into the classroom, and you're saying it's important we get our children back into the classroom, I'm going to have to go with that. We're here to represent everyone. I understand. I've heard everybody's opinions. We have to do what we have to do.
I just want to jump in on what Gina was saying, and that I agree completely, right? I've had the pleasure of serving with Superintendent Reisner. What are we going on, 3 years now? Like a prison
3 years, 3 years.
And I think, as I have said many times, I really appreciate you and your leadership, and have come to really trust your judgment. And there are, you refer to this as a tough decision. There have been, this is just one of many, tough decisions that we've had to make. And there have been several times where I've relied on your judgment because I don't have the expertise. But I will also say, you know, my husband always reminds me that as board members, we have the opportunity to get to know you and the administrators and the staff in ways that the community doesn't. And one of the things that I've come to know about you is that I appreciate that you are always sincerely there to show up for the children. And I have seen you time and time and time again, you know, take a punch from the community, take, you know, those emails from the community, whatever it to the anger, the frustration, because I've always seen you do what is best for the students. I've just always seen that. And so while this may be a situation where I'm struggling to understand, right? I think I was struggling to understand the metrics, but I understand better now. I thought you helping me understand about the data and what the data was indicating long-term is super helpful. That's what I needed to hear from you, because I trust you, I guess is what I would say, right? And if I didn't have some kind of explicit reason to question you, you know, I think that's where I would be. But I do actually have a question for Dr. Arnold. So we had this conversation on, I guess it was Monday. It feels like it was like a year ago, right? But I guess it was Monday. And so my particular concern, because Superintendent Reisner was talking about this model not working for certain people, but one of the specific concerns I have is around students of color in particular, especially African-American students and Hispanic students, because we know that that COVID impacts those populations differently. And so I guess, you know, you were going to look into that. And so I have a two-part question for you. Are you now able to speak to the risk to Black and Hispanic children under a full return to face-to-face at the elementary level, given what we know about how COVID impacts them? And secondly, do you have any recommendations specific to those populations for families who might be caring for children who fall into those categories?
So most of the research is based upon the CDC report that we both had referenced on Monday regarding outcomes for Black and Brown students in COVID, and noting that of the children who had died, over 75% of those were children of color, specifically Hispanic and Black. You know, there are the discussion in the articles I've read reviewing the CDC's publication talk about families making decisions whether or not to send people to school because of comorbidities or concurrent conditions within their own families. The risks of related to health disparities in general in that population. I don't know that there is a specific, other than the CDC report where it reviewed specifically deaths and with COVID and susceptibility, due to lots of reasons. You know, there's discussions that many of the persons of color are, their families are essential workers. So they may have higher rates of exposure due to what their parents do. So I don't know that there's a definitive right now based on their one publication with this on recommendations or strategies. I've also listened to podcasts and read some other research on areas that families of color are choosing remote options due to concerns about health and due to concerns about knowing that COVID hits certain different populations differently, right? Due to health disparities, due to other chronic conditions. So it's hard to say. It falls back to family choice on that and family comfort level. And, you know, knowing that it's again a risk tolerance, right? For that family, where is the bigger risk for them? It may not be.
I'm sorry, go ahead.
No, and that may not be the full answer you're looking for. I wish there was a this is exactly how we can handle it, but I have not found that out there.
Okay, and just one, I'll be real quick. One last question for Superintendent Reisner. I think part of I hear all the families and the emails, and I think we saw tonight, there's not consensus, right? There are families who are loving hybrid, please keep it. There are families who hate hybrid, oh my gosh, why did you do this to us? And kind of everything in between. And so I think that's part of what makes this hard. As a board member, what I would like to just ask is for the district to consider any way to please find, if you could find any way at all to keep some measure of the hybrid for families it's serving, I would just ask you to explore that. But I would like to hear from Superintendent Reisner about how, if there is a transition to face-to-face and there are these modified metrics, what are the ways that the district would plan to be responsive to the environment in the school? I think sometimes these decisions feel very permanent. And it's like, okay, now we're here and that's what it has to be moving forward. What does that movement look like? And that'll be my last question.
Well, you're free to ask questions. That's your role. So ask all you need to. So in terms of, I'm going to take that question in terms of in relation to our metrics or the permanent feeling of when we make a decision, are we stuck in that decision first as a district and second as parents? So the thing that I think I really appreciate is the flexibility that our district has taken. Now, we know that we're not going to be able to continue with this level of flexibility because it just creates a lot of staffing challenges. But the thing about return to learn face-to-face, parents who would like to still have the option to move their child if it's not working for them or if their family dynamics change, they still have the option to move their child into the remote campus. So, from a parent standpoint, the decision, if they chose, I'm going to come back face to face, and then they thought, my family dynamics have changed, or this isn't working the way we wanted it to, those families can still go back to the remote campus. We are going to need to limit the switching to face-to-face. So if a family is in the remote campus, they would have to wait until second semester to come back to the face-to-face model. So, and then from the standpoint of continuing to watch the metrics and work with our local health officials, I think that cannot be overstated. We have to continue to work together and we have to continue to learn from each other. And so I think that's where, while we have metrics and they're guiding metrics, if our health department says we see these numbers upticking, you may want to get ready for a transition to a more restricted model. That's where we still will. And Dr. Arnold is on weekly meetings with them, maybe even more often than weekly, but I know for sure there's weekly meetings with all of the city leaders and the health department and everybody. So we have a pretty good pulse on and can watch that together. But it's not one and done for sure.
So I hear I just want to clarify, I swear it's not a question, but so what you're basically saying is that you are anticipating being responsive to cold and flu season, because that was a concern I heard over and over again, that it's not we're face-to-face and that's just it, but that you would be responsive.
Yes, we had a really long discussion about that last night when we were in our meeting, and knowing that there could potentially be an uptick, knowing that may be in January, that may be, right around February, January, could be the end of December. Luckily, we're off during that time. So being responsive to that is going to be 100% necessary. And I think one of the things, just in terms of what we thought was going to happen, didn't happen in the beginning. So I'm trying to, in my mind, I believe flu season is going to be awful. And I think we're going to see an uptick, but I obviously don't have the medical expertise to make that call. And I don't know that it will be. I'm so hoping it's not, but we don't know those things ahead of time. So absolutely, we're going to have to be watching and monitoring. And if we see an uptick, we're going to have to move back to a more restricted model.
Thank you.
So you mentioned in your comments that there's these groups of children who have been at greater risk from the hybrid or trying to do some online learning, but because of their family situations, many of them may remain on remote, or we might see an increased number of remote learners who have to make choices if they're not comfortable with hybrid. Are you going to be able to provide more support for the remote learners? Because I know we've had some questions about what it's going to look like for them, and some concern that things will change significantly for them. So could you speak about that a little bit?
Yes, thanks. Great question. I'm going to ask Director Mixdorf if she can speak about. She is actually she's in charge of that remote campus, so she acts as almost the principal for the remote campus and meets weekly with that team. So I'm going to ask her to go ahead and speak to that. I'm hopeful that she's on as a panelist.
She's
Okay.
there.
Yes, thank you, Superintendent Reisner. That's a great question, and I appreciate it. And we continue to look at our instructional model, how we're serving students, the needs of our students. As Superintendent Reisner said, for students that are choosing remote campus, although we won't have it an open, fluid situation to come back on site, for students that are not finding success in that remote campus, I know administrators are reaching out, teachers are reaching out, support staff are reaching out to figure out what the barriers are for that and how we can either intensify instruction or remove barriers, and we'll continue to work through that. I don't know what how our community will respond to that and what that will mean for our remote campus in terms of numbers, and we may make some adjustments to how we're supporting our remote campus if those numbers continue to climb.
Sorry, Alan. Can I just ask one more question? Sorry. Is the plan to continue to use Ames teachers to teach remote for the most part?
For our K-5, we have not discussed changing that model at this time. We do know there's some dynamics to this because it depends on the needs of our community and of our students, and how we balance the staffing that we currently have in the models that we have in place. So as we come back 100%, although our social distancing may not remain at 6 feet because the class sizes will be greater, we will still be watching those class sizes and paying attention to the spacing and the social distancing. So we wouldn't remove staff from on-site and increase our roster numbers on-site to really high numbers. So it's kind of a dance of what our community is going to need from us, and all of the options I think are on the table, or I know are on the table, but right now our plan K-5 will be to continue to staff that with Ames teachers.
I had a comment that kind of related to several of the board members' questions and comments here. So bear with me a little bit. I've been thinking the last few days, how we've gotten to here from where we started. And kind of as I said initially, I wanted to really just kind of follow the science as far as what we do and what we decide. And of all things, I was watching a documentary the other day of Dr. Fauci and some things he was saying. And some people were asking him, originally you didn't like cloth masks, right? And then he said, well, yeah, but then we got more data and we changed. That's what science does. And we need to follow the science. So as I was looking at this and thinking through the science, originally, when we went online only, we were looking at the numbers and the metrics as they were, and that's the judgment we made. But now there's been national, state, and even local information saying that some of the concerns we had about the schools being a place of spreading, where I would define spreading as if a child goes to the school and is positive, and by doing so, they make someone else positive or make a teacher positive. So they're passing COVID in the school. That doesn't appear to be happening. And there's a lot of ideas about that, but the main ones are because of those mitigation strategies that are strictest in place at a school compared to anywhere else right now. So I guess the comment I had, maybe a question to the board, and I think it relates directly to last comment Director Binkin had about responsiveness. I think that one thing I would like to say to the staff and the community is, from my perspective on the board, I think there's kind of a hard line where, regardless of what the metrics are, if we have what looks like spread within a school, or someone that's positive has come in and a teacher has gotten sick or a student has gotten sick, it doesn't matter to me what the metric is. That's kind of a hard line for me that we need to take a step back, consider, Jenny would make a decision, do we need to close that school for a while? But we definitely need to look into that. So to me, that's the main thing I'm watching as far as the safety, is I want to guarantee that parents can send their kids and staff can come into the school and know that we are doing everything possible to say that you will not be less safe here than you would be anywhere else, and hopefully you will be safer. But I just kind of wanted to throw that out to the board because I know we haven't addressed that aspect of it. But to me, like I said, that to me is a hard line that we have to ensure and that we should be promising to our community and staff as far as how we would respond.
Director Linkaitis, I want to go back to your question because I think transparency and really direct answers are important tonight. And so I'm not sure that I want to make positively sure that you got the answer that you needed. And so in all transparency here, Adam Wolf asked a question about secondary, and tonight our focus is on elementary. But one of the things I heard in your question, I believe, was, looking at the remote campus across the whole district. And it leads me to that place of we are doing everything we can right now and talking with the local medical community about how we would be able to safely bring back our secondary students. There are some challenges that we now have shared with them, and those challenges have to do with space and lunchtime and those things that you heard about before. But our goal is to get our secondary students back by second semester. Now, there's a lot of work that is going into that. We are not planning for that. We are working really hard right now to plan for that and work through those barriers. Our meeting last night was really helpful because there was some thinking outside of the box that went on. In terms of the remote campus, our elementary teachers currently are able to serve our elementary students in our remote campus. Ames teachers serving Ames students. I don't anticipate that will be a huge change. The change could be that we have to, if we have more students go online, we'd have to take a teacher in the classroom because they're not in the classroom, they went online, so the teacher would go online. Okay, that could happen. Our challenge at secondary is much different. Because of the way secondary schedules work, we have to have a certain amount of teachers and they have to be certified in certain areas. And so in order to make an on-site program work, we may have to pull from teachers who are teaching remotely or teachers who are then become full class teachers then that is all they do. They're not doing both like they're doing right now. They would teach just in person, and we would potentially have other teachers, not Ames teachers. So whether it's Edgenuity teachers or a distance teacher, but that the reality of it is that will probably happen. And that's where we're at right now. You know, we're in that planning phase. I'm not saying 100% because I don't know that, but I just wanted to make sure that your question was answered because I think it's a really important one.
I just want to make sure that those parents who are choosing remote because they're doing it for safety concerns of their child or family members, that they're receiving equal education to those in school. And so you've been talking about the importance of getting kids back to school for a variety of reasons. But there are people who will just not send their kids back. And I want them to feel that they too are being considered and are being given the same opportunities the kids in school are given. And so we've had several letters with those concerns, and I don't want their voices to not be heard in this discussion because they're just as equally as important as everyone else who wants to get face-to-face. You know, listening to all the parents speak tonight and the letters, there's no easy decision here for any of us. It pulls at my heartstring. I can see both sides of every story. And I wish we had an easy answer. And so the only answer that I can support is that all groups are going to get equal education, the best of our district's ability to provide them, and that parents have choices that they need to make for their families and for their kids, and that we're there to support those choices.
Thank you.
Superintendent Reisner, I wanted to just go back to something that you had said in your comments about the students who are not being served in the hybrid model. And I'm thinking along the lines of Michelle. I know several families who have contacted us who have kids who are high risk with immune disorders or different things like that, who have IEPs and who have 504 plans. They're going to stay remote. And I think that what Director Linkaitis said is very important about making sure that their needs are being served as well. I was also curious, though, when we looked at the data on Monday, most of our underrepresented populations, special education students, homeless students, the system has been failing them for a long time. So that's not anything new. So I guess I'm curious what's the tie between the hybrid model and knowing that it's not working when we have data that shows it hasn't been working for a while?
The data showing that our educational program hasn't been working in the normal years is what you're saying, right?
Yes, exactly.
Yeah. Well, so I would say that knowing that a system isn't working means we change it. So knowing that hybrid isn't working means that I've got to make changes. So in our normal system, the same thing is true. We are absolutely in a state of these, in a normal year, these barriers have to be dismantled. Our critical consciousness has to reach the classroom teacher, and they have to be educating using that lens. And so I'm absolutely not okay knowing that any model is not working for all of our learners. And so that's where we're at. You know, we're not in a normal setting, so we can't make those adjustments, but we certainly can hit it hard when we come back to that setting. And then the setting that we are currently in, we have to dismantle it if it's not working. So when we come back, there is going to need to be some focused interventions that are going to happen. We really need to look at our system of tracking students. That I remember Director Benkin talking about that clear back, maybe in my interview, but it might have been my first conversation with her about the tracking of students. We can look at the data and see the results. So this is probably a bigger discussion on a different day, but I love this discussion, so I get really passionate about it. So we can't continue to have students who are marginalized, and I'll stop because I know I could go on long on this note. So.
So I came prepared to vote on the metrics, and now a new set of metrics is being introduced. So that's extremely confusing, and it's the same night that we're voting on this. So I'm not particularly thrilled about that, because we had a set of metrics, and that's what I think we told the community that we were going to follow, right? And I know that it's a guideline, but right now, as it is right now, the guideline says that we should not go back. So this is where I am, and I feel that by saying that it's not that I don't trust Superintendent Reisner, it's that I need more. And I'm not getting enough information. I'm not getting any substantial information aside from the metrics that we all agreed on. So the conversation right now is that we may perhaps change the metrics, but then what? I'm not sure if I'm following what we're doing, if we're not actually following the metrics today. I'm just not ready. The way that I see the metrics today, I'm not ready to vote to send elementary back. So I'm not ready to support that.
So Director Colton, I need to be clear when you say you're not getting the information you need. I need to know exactly what that is, because if you want data, it's longitudinal, and I can't give you that. So I know that that's difficult, and that's where I'm saying, there are limitations to that. If you're speaking about the metrics, then absolutely there is additional data that we can provide around that.
Yes, so I think I'm confused, because I think we should go by what we said that we would do, that is using the metrics. And it seems to me right now, and I understand we don't have the data about the student performance. So then if we don't have it, that means that we don't have it either way, that it's working or it's not working. So if we don't have that piece, the only piece that we have is the metrics.
What you have is you have educational leaders, directors, principals telling you that it's not working. That's what you have. So I'm not, and you don't have to vote yes.
I know that.
Absolutely. This isn't, I'm not trying to do a sales pitch, but what I'm trying to say is that you can stick with the metrics. Absolutely, that can be what you stick with, but I'm saying that the model that we're in is not meeting our students' needs, and the data is not there because it's longitudinal data, and what you're left with are the people that you put into place to make those decisions. And so that's what you're left with, make those recommendations.
So then I understand that. I just don't know why we're talking about doing other metrics if in the end that it's going to be it's just going to be, which is fine if that's what it is. I just want to be clear that why are we working on metrics is that if ultimately what the decision is going to be on what you and the staff have seen, which is fine if that's what it is. I just don't want us to have not clarity on what it is that we're using to determine whether kids go in and out of different models.
So I think that the reason you asked at the beginning of that, you asked I don't understand what the reason is that we're not using the metrics. The reason is because the medical experts have told us they don't support those metrics. They've come out publicly and made that statement publicly that they don't support our metrics. So that's why we're looking at the metrics, because our medical experts that helped us create them no longer support them. And so that's forced us to go back and say, okay, what do you support? That's where we get the 8%. And what do you recommend? And that's where we get that we want kids back in school. You need to get kids back in school. The 8% is what we feel comfortable with. So that's why, and that's the why behind it. And I know this is so hard and there's questions that are not going to get answered, but I have to make sure that the reason we're talking metrics is because the medical experts, that is what they believe we should be talking about right now. If we're using the metrics, and I hear you say you need to use those metrics because that's what we've told the community. So if we're using those metrics, then I need to be clear that is not the recommendation of the medical professionals. And that is not the recommendation of the superintendent.
I think one of the things it is where I can appreciate where Jeanette is coming from is the approved metrics in the district right now are at 5% and the 10 case count. We've been provided with updated information from the medical community tonight that those are in need of reworking. And so we've been provided a recommendation for 8% and the less than 20. So I can understand that maybe the order of the approvals is maybe off. I guess where I would, being someone who has been was very supportive this summer, and I would say adamant that we needed metrics because we did bring it up multiple times, and I know that I was a part of the group that really desired those metrics. I really appreciate Dr. Arnold and Superintendent Reisner working with the medical experts and getting new and updated guidance from them on those. And so while the order, it would feel maybe better to have those approved by the board before we make this, we vote on this. For me, I'm not going to question the medical experts. This has been a really unique situation because it's been the medical community and the education community that have collided on this global pandemic. And I guess the way that I have tried to organize my thoughts and organize them in a way that because this is incredibly emotional, because we are all, the anxiety for everyone, whether you're very committed to whatever your position is or not, that it's just a very high anxiety situation. So I've tried to be methodical in my thought process. And so I look at it from a medical sphere and an academic sphere. For the medical sphere, it is, we have heard from Story County Public Health, we have heard from our hospital, Mary Greeley's, I think, one of the top hospitals, if probably the top in the state, maybe the region. And so we have heard, we are so fortunate to have the local medical experts that we have. So I know that I am putting a lot of faith in them when they come to us with updated recommendations. But I don't have a medical degree, so I am not going to, I can't question that because that is not my area of expertise. In terms of the academic piece, Superintendent Reisner, I am not trying to take anything away from you, but when you say this is your recommendation, my assumption would be that this is a recommendation that you bring from your team as their leader, that this is something that you work with your team to create, that you utilize all of those professional lenses to look at the different things that need to be addressed within this. Can you speak to maybe how you and your team have reviewed this and come to this recommendation for us in a brief, high-level manner?
In a brief, okay.
Yeah.
All right. So we, our team meets every day. We talk about what are the concerns, what are the logistical challenges going on, we're getting parents, we're getting teacher questions, so we go through that every morning and have kind of a debriefing and look at where our gaps are. We have a pretty good sense from those meetings because the directors and all of us have direct contact with others. So whether it's principals that we're hearing from, we have, and again, there's meetings with them throughout the week to collect all of this information that we go over every single morning. So there's that line of communication. How are things going at the building? What are the challenges? We meet then once a week with the building principals. We talk through challenges. So that's a constant back and forth that goes on. Darcy in particular with our special education teachers do progress monitoring, and Darcy reviews that, the principals review that, and Darcy has a coordinator that reviews that. Darcy also meets regularly with parents who are having struggles. Dr. Jones is meeting regularly with parents of students who are English language learners and teachers. So today he spoke to us about his meeting, I think it was yesterday, with the EL staff, our teachers, and what their concerns were, where they're seeing gaps. And so that's where we are getting our information, is this constant check-in, report in, meeting with parents, meeting with our principals, going back to the table. And if I knew that this question was going to come up, I could definitely lay out our process because it's something I'm extremely proud of as a result of COVID. This is one of those unintended things that has come where we really feel there's a lot of alignment for the first time. We have a long way to go to get that alignment clear to the classroom, but we feel that alignment is improving, and so that's where we're getting our information. We're monitoring other data on a weekly basis, but and our participation and attendance data. And
okay. And I shouldn't take from Dr. Arnold has been provided as a bridge between the medical and academic, so I don't want to take anything. You weren't here a year ago, Dr. Arnold, because we didn't have this dynamic of when the medical and the academic kind of collided together. So I don't want to take anything away from you. Talk to me. You speak often about your interaction with the Urban Education Network superintendents. How often are you working with them to understand the dynamics of this pandemic and the impacts on their schools?
We meet at least once a month, many times more often. That's the urban superintendents. There's usually weekly communication that's going back and forth, asking questions of each other, more logistical questions that we may have that come up that we're struggling with, and we're sharing documents and information back and forth. So our meetings are at least once a month, sometimes more often. And then we have been having weekly AEA superintendent meetings, and that is superintendents across the whole state come together weekly. Those just got moved to, I think it's JD would know, but I think it's every other week now, just because most of our, or a large number of our superintendents, a lot of their questions have already been answered. And so they're in that mode of whatever their learning model is. And so some of those discussions that we were having that needed to happen every week, they're not as essential anymore. But we meet, share information. We have a shared document that we can look up to find out, information that forms the way people are staffing, things like that.
So would you say that you've been informed by those interactions too, as a part of this recommendation?
Oh, certainly.
Okay. I appreciate the, I think that it's hard. Certainly there are additional data points that I think that I could probably ask for, but I struggle being in a place that I can't listen to our medical experts and our professional team of educators. So I appreciate you bringing forward this recommendation. I am very willing to support it because of the combination of those individuals, those professionals in those different fields being in support of it. So I appreciate you bringing forward a recommendation it's difficult to bring up because we know that it creates a lot of anxiety and it is change. But as you talked about that continuous learning model, I think that's a part of what we're doing here, is continuing to learn about this and understanding better ways to serve our students. So I appreciate you bringing the recommendation forward. Are there any other comments?
Quick question. So with that, the teacher survey was the union teacher, the members of the union. Do we know what percentage of teachers belong to the union, or what percentage of teachers that they're in the union filled that survey, I guess, as well?
Yes. Yep. Good question. And so that the answer is 80% of the staff completed the survey. We are not able to track anymore the number of staff members who are survey members. We're not able to track the number of staff who are union members because we don't have a way to do that anymore. It's not, their union dues don't come out of their paychecks or anything, so we don't have a mechanism for tracking that. But I can certainly find that out probably before we even get off this call.
So the survey didn't only go to the union member teachers?
It did.
Okay, that's what I want. Okay.
196 total in the union. Somebody was listening in. That with me.
100 and how many?
196.
Okay. So I guess I want to be clear at the way that I'm voting. I am not opposed to bringing our littles back. I know it's something that it needs to be done. I am not disregarding that the medical professionals. It's not sitting well with me how this is being presented the same day. And we spoke to the medical profession just last night. So it feels very, it feels that this is nothing that what we have been already communicating to our community or our teachers for that matter. So it's very different than what we agreed, which is fine, it's fluid. It's just that right now, it's just not what we have been communicating to our community.
I want to echo what Director Colton said, because I also am not opposed to bringing back elementary. The process that I would like to see for that to happen would be to revise the metrics, vote on and approve the new metrics, and use that to inform the decision that's made. I'm struggling with the new metrics because while I respect the opinions of our local medical experts, they are not experts in infectious diseases or epidemiology, and the recommendations that are coming nationally and internationally from the experts in epidemiology and infectious disease are matching with our current metrics that we have. And when we first got these metrics, we had a long list of sources. This is why we're recommending this. This is where it's coming from. And we don't have that for the new metrics. So that's where I'm struggling, just as Jamette said, with the process.
Are there any other questions or comments? And just to, I'm not just, I'll call on you, Monique. For those that have, I noticed we have a couple of hands raised. I am not ignoring you. Once we get to action items, we no longer take public comment. So I'm not ignoring it, those with their hands raised. Director Benken, did you want to say something? You were waving at me.
I just had a question, okay. Yes, and I threw a little sticky away, had it out. So I'm thinking of the day we're supposed to bring, oh, here it is. That's not right. There it is. Okay, so you're thinking of bringing back 3-5 on 11/23, which is the week before Thanksgiving. And I think we got an email from a teacher, I don't know if you received it, but who was asking why that decision, and if we could revisit that decision.
So we gave a 2-week window. We talked about not bringing back 3-5 until the following week. Sorry, I just saw something flash on my screen. I thought I was losing my power. We thought about waiting a week, and so it would be one additional week. In our discussions with the union in the past, we drew from that, where they said that it is easier to, it's easy, and we did not go to them with this. So let me be clear. I'm not saying we ran this by the union. We did not. But in the past, we've talked about that phased start where you're not going a full week. So we kind of figured that it really didn't make a difference whether we just went 2 days and then came back full-time the following week with all students. So it was just based on that information that we had in the past, and not seeing a reason to delay it until after Thanksgiving.
Given that there was a concern or a question raised by a teacher in the 3-5 range, and there would be time, would the district consider, just maybe giving that some more thought and bringing them back the next week? I mean, we're talking 2 days. Yeah. And so, I just wanted to voice to make sure that was, because that did strike me as odd as well, because it's transition. And it just was, if there's a way to consider that, I just wanted to be sure that was in the conversation.
What I would probably do is let our building principals weigh in on that. I think they did initially, our elementary principals, but if maybe they've heard from staff members since then. So I can definitely check into that.
All right, I am not seeing anybody take their mute button off, so I'm assuming that is the completion of our discussion. So it has been moved by Benken, seconded by Beerbaum, to approve the superintendent's recommendation and I can't read the whole thing, I'm sorry, because it's blocked on my screen, to approve the superintendent's recommendation to return to 100% face-to-face instruction for grades PK to 5 on the following timeline. PK2 starting November 9th, 3-5 starting November 23rd. And board, I think I'm going to have us do a roll call vote on this, not to call you out individually, but in the event that, because it's hard for me to listen for voices and see your faces moving. Is that all right if we do it that way? Everyone's okay with that? Okay, so I am just starting on my screen, Lenkaitis. So, yes, so Lenkaitis, sorry.
Aye.
Shields Cook.
Nay.
Beerbaum.
Aye.
Bankin.
Aye.
Perez.
Aye.
Colton.
Nay.
Franzen. Aye. The vote passes 5-2. I will entertain a motion to adjourn.
I
I move we adjourn.
Second.
Moved by Beerbaum, seconded by Perez. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. Thank you very much, everyone, for joining
Thanks,
us this
everybody.
evening and for all the attendees.
Bye.
We appreciate you being a part of it. Take care,
Good
everyone.
night.